All right. Good afternoon and good evening and good morning for some of you. I think Hala is not here yet. So on behalf of Kuiha team, I really welcome you today on this function and the webinar about having career in occupational medicine, whether it's the first time to hear about the specialty or you are already a veteran in the process of making, we welcome you. And this webinar is part of Kuiha work in developing the field in Africa and in the region. We welcome you today in this series. We had a webinar last year talking about having career in occupational medicine, but exploring different paths, starting from the Irish faculty, going to the British and the American as well. If you're interested in any of those schools, we will be happy to provide the links of our previous webinar. But this one will focus mainly on choosing the route for the Irish faculty. Why we chose the Irish faculty, Dr. Omar and Dr. Mu'tasim will be more than happy to present some information about the specialty itself, about the exams of the Irish faculty. My name is Hadir Musa. Some of the family already here with us, Kuiha family, and for the newcomers, we welcome you and we're happy to have you as part of our family. I'm a medical doctor, graduated from Juba University, and I'm an occupational physician in the making as well. So I will be like taking the journey with you as well. Dr. Omar is like a veteran in the field. He's a senior consultant occupational physician with a vast experience in the Middle East, in the UK, and in Africa. Dr. Mu'tasim as well is a senior occupational health physician with a very vast knowledge in the field. He's even an examiner in the Irish faculty. We welcome them both and they will take us through this webinar. It will be for 2 hours. The first hour will be Dr. Omar and Dr. Mu'tasim talking a little bit about the specialty, what do you expect, what does it mean to be an occupational physician. And the second part will be like another hour just for discussion, whatever question you have. Just feel free to raise your hand and we'll be happy to answer your questions. Thank you. And over to you, Dr. Omar.
Thank you very much, Shadir. Thank you very much, and welcome everybody. I'm absolutely delighted to have you all here. I think some more people are coming. Really, the people who registered to attend today's webinar are probably the most diverse group we have had since we started this. We've got colleagues from Rwanda. I think the 4 of them have already registered. Probably Hadir will see whether they are here or not. And we got colleagues from South Sudan. We've got colleagues from Kenya. We've got colleagues from Tanzania. We've got a colleague from India. And we've got, lots and lots of our good colleagues and friends from Sudan. So you are all welcome. The idea of this webinar is really very simple. Last year, as Hadir said, there was a general talk about career path in occupational medicine, where we talked in general about if you want to be an occupational physician, an accredited, professionally qualified occupational physician, what routes are available to you in general. And since that webinar, we had the pleasure of tutoring some of you, some who are already here over the course of last year. Some of them are still ongoing through the Irish faculty professional examination route. So we thought this talk would be really just concentrating on this route rather than giving you a general idea. The talk, we're not going to talk a lot, to be honest with you. I'll speak about the core competency that an occupational physician needs to practice occupational medicine, and how you acquire, these competencies, and where are we, and our experience, from the previous course we did. And Mu'tasim, when he is here, Mu'tasim is usually very busy during the weekend. He is the head of the Sudanese community in Cork, as well as so many other things. So he was in a function, and he texted me earlier to say he got in the car and on his way to somewhere quiet where he would join us. And Mu'tasim will go through the details of the actual Irish faculty examination. Okay, this really is quite informal. I will go, some of you would probably this would be their first ever, interaction with an occupational health function. And that is why I would probably say some really generalized talk about occupational health, and then I will go into the details of the addition to the medical group in the family. She just graduated this year, but she has been supporting Kuiha with lots of work over the last few years. Anyway, let us talk about occupational health. And it really is just ironic that this is a specialty. When you start talking about it, you try to explain it to people. I've never seen an obstetrician or a surgeon or a pediatrician who stands in front of people and say, do you know what pediatrics is? Or do you know what is obs and gynae is? But occupational health is just this sort of a specialty where you actually have, so much little knowledge about it. And the little knowledge is actually not just, the lay people or outside the medical field. Even in hospitals, people will, if you say you are an occupational physician, people will ask you, what do you actually do? What is your job? So I'm really not trying to be, very clever here or tell you things that you probably don't know, but I just wanted to talk about 3 different parts which are very confusing within occupational health. The term occupational health itself, the term occupational medicine, and the term occupational hygiene. These are the ones that everyone uses when we talk about occupational health. Occupational health in general, what is in that slide is this is the definition of the World Health Organization with the WHO from a shared conference even before I was born, talking about occupational health as the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. So if you think this has happened almost more than 70 years ago, so why are people not still, not got enough knowledge about occupational health? In reality, occupational health is an organized program that involves lots of people from different disciplines to actually work on maintaining this highest degree of physical, mental, and social well-being of workers in all occupations. So this is the general term. Occupational medicine is the clinical aspect of that. This is the actual clinical specialty. And this is why, we have invited you today as doctors. We have not invited nurses or physiotherapists or health and safety people, or even occupational physicians. And this is the clinical specialty where, well, to be fair, it is doctors and nurses who actually are engaged with the clinical aspects of occupational medicine as clinicians. And you got the occupational hygiene. Occupational hygiene, again, this is the science of actually using all the technology to actually maintain the highest degree of physical, mental, and social well-being. It is not, again, as we will see, it is not about measuring things in the workplace. It's not about environmental measurements. This is a much more to this. Understanding how these physical or chemical hazards actually affect the health of people, and what do you actually do to control the risks from them. Hadir, can I have the next slide, please? Right. So let us talk about this occupational medicine as a specialty. And it is, as I said, it is much more than hepatitis B screening. You as doctors, when you join hospitals, especially in the first world, the first thing they will do is they will probably send you to occupational health. And you will, 99% of the time, you'll find a nurse who will say, right, where you come from Rwanda, from Sudan, from South Sudan. Okay, right, there are lots of things that come from those parts of the world. Let us firstly screen you for tuberculosis, okay? And then after that, they screen you for hepatitis, B and C and HIV, and see your, whether you've been immunized and the level of your immunity and all of that. Occupational medicine or occupation is much more than this, okay? It is quite a diverse specialty, and it is a truly multidisciplinary specialty. And I'll talk about this in a minute. When we speak about diversity, if you think of an obstetrician or a pediatrician, you will see someone who has got a condition or a disease. You know the disease, you know the causation of the disease, whether it is caused by a mosquito or hormonal imbalance or whatever, and from your knowledge, so yeah, you do your tests and whatever. In occupational medicine, you need to know much more than the disease. You need to know the disease, definitely. You need to know how you investigate it and how it is treated. Two important things. You got to know how this disease is associated with work. And this is part of what, what occupational medicine is about. It is about, the relationship between work and health. There are health conditions that are caused by work. We all know if you are in your work, you are exposed to high levels of noise, you will be deaf. This is called noise-induced hearing loss. There are, certain chemicals. If you work with mercury, for example, people who are extracting gold, yep, you get, the madness of it. You get the renal failure. You get all sorts of conditions. So this is caused by work. There are some conditions which are associated with work. There are some conditions which they have got nothing to do with work, but people with these conditions can actually cause serious harm to themselves or to others if they exhibit some of these symptoms. Someone with epilepsy, for example, if he is a driver, he gets a fit while driving, and he could kill himself and could kill, lots of the road users then. Another very important aspect is understanding, the connection between the hazard and risk and the control measures. And this is all part of that. And you handle all of this within a really tight framework of legal and ethical atmosphere. You got to know the regulations, the health and safety regulations. You got to know the ethics, the rights of the individual, what you can tell the company, what you cannot tell. And we'll talk about this. Multidisciplinary is a term you probably, or some of you, or those of you who are in occupational medicine know that in occupational medicine, we do not treat. We can diagnose. This is how it is set up in the first world. And, when we come to talk about things later, hopefully, or when you go on and see that, this is one model, which might not be, the best for us here in the low and middle income countries, because there aren't many health professionals anyway. In the UK or in Ireland, you see someone with a medical condition, or even you diagnose occupational asthma, and you tell the individual, okay, go and see your doctor to treat your asthma. If you say to someone in Rwanda or in Sudan or in South Sudan, go and see your doctor, he would think you need to see a doctor yourself, because you cannot be the right person. So multidisciplinary to me is actually using the multitude of support within the medical field to actually progress the health of the workers. This is the way I look at it. Hadid, can I have this slide, please? So let us talk about the occupational health physician. And I sincerely hope all of you who are here today, the 26 people, or if we remove, if Mu'tasim and myself, the 25 people who are there are all on the first or on the road to becoming occupational health physicians. Occupational physicians are a really rare species. Mu'tasim is here. He would probably be able to tell us how many occupational physicians are there in Ireland, but I can tell you in the UK, there are 1,000 occupational physicians. This is compared to 14,000 internal medicine specialists, 4,000 pediatricians, and 7,000 surgeons. And you can actually see the huge difference, the absolutely huge difference. But let us leave UK and Ireland aside. In Sudan, when I left Sudan in 2021, the end of it, there are only 4 registered specialists in Sudan Medical Council. Only 4 doctors. I am one of them. In South Sudan, as far as we know, there is not a single one. In Rwanda, there is no one. In Ethiopia, not a single physician. What to make things even frightening, Ethiopia's population is more than 100 million. So you can see the gravity of the situation. But I can tell you, things are changing rapidly, really hugely changing. And your presence here today is just a testament to this. There are at least 20 people of you who are new, who have just registered to come and attend today's talk about that. If I want to talk about a typical work in the life of an occupational physician, there is absolutely nothing you can call a typical work. Mu'tasim is in Cork in Ireland. I am currently in the UK in Cambridge. We've got just one sea separating us, and Mu'tasim does a totally different job to the one I do. It all really depends on the role and the industry you are in. And one of the most telling and fascinating things about the role of occupational physician was an article written by Dr. Aisha Hashim. Aisha is a young, she is still young. She's not here, but I can say this. doctor from the UAE. She is the fairest member of the faculty of occupational medicine from the UAE, and the faculty interviewed her after she passed as the fairest member from the UAE. About her day. She was a family physician before, and she said she's always felt so proud to put her, white coat on and hang her stethoscope around her shoulders and walk the corridors of hospitals and clinics she worked in. She said it was absolutely fascinating when she joined occupational health to get up first thing in the morning to be driven to a small airport in Abu Dhabi called the Batin Airport to get into a helicopter already in overall and hard hat, get into a helicopter to be flown to an oil rig in the middle of the Arabian Sea. And she spends her day there. And you just can't imagine, the difference between that young, girl with the white coat and the stethoscope. And I'm sure lots of, our female colleagues would, identify with this. And just this same individual with, overalls and a hard hat, in a helicopter being flown to an oil rig in the middle of the sea to spend her day working there. But in reality, there are so many different things. You can sit in a clinic and see patients. They come to you with all sorts of complaints, and you got to, relate those complaints to work, whether they're caused by work or whether they will affect the way the individuals do their work, and whether these people are really fit to do the work they're doing, and if they are not fit, is this on temporary basis, or is it forever? So this is a lot of what we do, and as Mu'tasim knows, we call it the bread and butter of occupational health. But there are lots of subspecialties within occupational health. Aviation medicine, that looks after people in flights, diving medicine, disability medicine, travel medicine, radiation, and there are some clinical specialties. Hadir did research a couple of years back with a group of occupational lung disease physician from London, and that is their specialty. They work at the Brompton Hospital. They just see lung occupationally related lung diseases. There are occupational dermatologists who just look at the skin conditions related to work. So within that, there are lots and lots of it really is quite varied. Hadir, can I have the second slide, please? This is one of those slides that looks very clever. So I'm really not going to go, a bit through it. But this is from the core competence, a booklet written by a joint committee for Europe. What an occupational physician, what base of knowledge they should have. But what I have prepared in the coming few slides, and if Mu'tasim is there, please, Mu'tasim, you can jump in absolutely anytime. From the next slide on, I think there are about 11 slides. I'm going to talk about very specific core competencies that every occupational physician should have. And when I say this, this is not a theoretical thing. This is really is this is what you are going to be examined on. Every single one of these will feature in your exams, in the LFOM or the MFOM. Hadir, can I have the next slide, please? Thank you very much. I've got this from the UK Faculty of Occupational Medicine, and they call them learning outcomes. So they decide on these learning outcomes. Okay, you got to know them, and they test you through your training in each single one of them regularly. and it's not, and it's not difficult. Okay, and I think it will make, especially for the chaps who are here, who are taking their exams now, if you know what is expected of you, I think things will be much easier for you. Okay, so there are lots of barriers for us. We have found in Kuwait there are lots of barriers for us, doctors from the low and middle income countries. The barriers is the lack of training in occupational medicine. Um, lots of us, I mean, I had the privilege of studying in one of the most prestigious universities in Africa in my time. Occupational medicine was never mentioned. I don't think I've ever heard about it at all. Okay, so let alone in the undergraduate, even in the postgraduate, degrees, there are still not many in the whole of Africa if you think about it. Um, Again, there are the lack of role models. In every specialty, they would be the eminent physicians, the eminent surgeons. No one, I mean, probably lots of you, if you sit back and think, do I know an occupational physician, eminent or not? Probably not. Probably not at all. And then the other part is, the lack of proper service provision. Let us not talk about, Rwanda or Ethiopia, where there's absolutely no service provision at all. I've been, I worked in the Middle East for quite a long time, and I think in the interest of time, I'm not going to go into stories. But there are now lots of occupational health services. But if you go and look at the services that are provided, they've got probably just the name of occupational health. In actual reality, it's just very crude and intrusive medical screening. Two very important issues: the language, and I really, my advice to you, until today, we are totally dependent on faculties and colleges that teach and speak in English. And it really is just so important that we perfect our English. I am now working with some of my colleagues in the report writing, and and it is quite true. Their report is not marked just on their knowledge of the condition or whatever. It is marked on the grammar and spelling. So please do work on your English language. That is very, very important. And then the other part is the culture. And this is a bit more difficult to work on than the language. Most of us in the southern part of the world think doctors are, the God-given species to the people, and your word is above any. And it really is very important that, you understand totally your role, and you understand the autonomy of the individual who is sitting in front of you as a patient or as a worker. These are really, really very important aspects. And you will be, in the OSPE examinations, if they ask you to examine an individual, even if you are the most clever neurologist and you do everything, and they, examiners feel for a second that you are treating the individual who's sitting in front of you in a way that, does not preserve, their rights, you will fail the exam. You will absolutely fail the exam. And I have been there, and I have seen it. And I have seen it happen not once or twice. And this really is very important. Okay. Hadir, can I have the next slide, please? Right. Okay. Well, I'll go through this very quickly, and I'll just give examples. So the first one, is the professional values and behaviors, which I was just talking about. The ethical, parts of what we do: the confidentiality and the legality of what we do. What you tell the employer, what you tell the employee, and this got to be very clear in your mind. Absolutely. You cannot sit in front of an employee or a worker and tell them something and then go and tell the manager something else. And they got to agree to what tell the manager. They got to see your report because it is about them. So this is all part of the things that we try to get people to understand and know. Everyone who attends today will have a copy of these slides, and you will have the actual chance of going through these and looking at them. Hadir, could I have the second slide, please, or the next slide? Okay. Communication, and this is exactly what I was talking about earlier. We cannot, unfortunately, write our reports in Arabic or in Kenya-Rwanda or in Amharic. We will have to write them in English. So we will absolutely have to perfect this. I think if you take from this slide, just from this slide, when you talk about communication, if you take just the aspect of medical report, you're going to be asked about this. The Irish faculty has got a total chunk of the exam dedicated to the medical report. You will sit and you will write a medical report about an individual and send it to a manager. And I know some of my good colleagues are here and they're listening and listening to this. And you can see, I literally copied this. Demonstrate the ability to produce clear, legible, and accurate reports in written form. So you'll have to write it with your hands. Unfortunately, you cannot use ChatGPT in the exam. Can I have this next slide, please? Clinical practice. Again, this is something that is unique to occupational medicine. It's completely unique. And I think some of the, Khalid and Khairi are here. Yesterday or the day before, we were talking about obstructive sleep apnea, not about what it causes, it is symptoms or whatever, and the 3S or whatever, how you actually diagnose it, what is involved in it. So you really need to know quite a lot of good clinical knowledge about so many conditions. Because without knowing this, you will not be able to give the individual or the company good advice. Okay. If someone has developed, epilepsy, or he developed a seizure, okay, is this going to happen again? What is epilepsy? Okay, what is epilepsy? I remember from my days, neurologists used to say every individual has the right to have one seizure in their life without being called epileptics. Okay, does this work in occupational health? But the important thing here is you need to be a good clinician, and this comes with practice and experience. If you've done, and that is why it is just so important for our young colleagues who want to join the specialty to wait until they actually perfect their medical knowledge before they progress to that. And I remember a funny joke, when one of my colleagues saw someone who told him he's got retinitis pigmentosa. And he said to me, I had no idea what the hell was that. The thing, was it in his knee? And he said, right, okay, retinitis, that got to be the eye. What does it do? So you really got to have some really good background knowledge of not just the names of the conditions, but how they affect the individual. What is their natural progress as a disease? Okay, can we move on, Hadir, please? And this is the thing that is unique to occupational health. Okay, the risk and the hazards. That is really, really, really important. And it is not, it really is not just, we're not, we are, at the end of the day, we are doctors, we are clinicians. But as I said, when we say, the multidisciplinary is you use those other disciplines to your advantage and to the advantage of the worker. You can, it is very easy when you go and read about noise, for example, you do not have to have a uh, a dosimeter, attached to you to know that this is just an intrusive, amount of noise. You can actually, just know it. If you cannot talk to people, within one meter, cannot hold a conversation, this is probably abnormal. Okay, and then you need to get someone who can do the actual measurements for you, and think about all the control measures, and about so many other things. So, and you will be asked to do a risk assessment. You will be asked to go into a workplace and look at the risks and think about how you control them and think about their effects on the workers and what control measures are there. Can I have the next slide, please, Khalil? Um, this is again one part of occupational health which utilizes your knowledge as a doctor. We spend lots of our, living time within the workplace, and we got to affect, positively the health of the workers. The whole issue, occupational medicine is part of preventive medicine. So you do not wait for people to develop occupational asthma and advise whether they're fit for work or not, or, you got to get in from the very beginning and know there are issues there. But it is not about that. People uh, eat too much, drink too much. There is diabetes, blood pressure, all sorts of, normal public health issues that affect the individuals, and you are supposed to have an input into this. In your portfolio, it will look really, really good. I'm not sure, Mu'tasim will speak about this later, whether you are actually required to write, a report about a health promotion project you introduce to a working population. Hadir, can I have the next slide, please? And this is again the leadership and team working, and this is particularly important for you. Some of you will be the first occupational physicians in their countries. Hadir and Mu'tasim will know we are now in discussions with Bahar Dar University in Ethiopia to establish an MSc degree in occupational medicine there. And lots of the discussion there initially focused on why do we do it as occupational medicine, not do occupational health? And our vision, which is part of the mission we have in Kuwait, is we want the first cohort of trained occupational physicians there to lead the development of the services in Africa. That is why we want to train occupational physicians. So we look at you as the future leaders of the specialty, wherever you are. And and when you look at the requirements on on 6 from A to D, it all just follows that, but it follows it from the UK perspective, because in the UK there are health and safety laws that makes it mandatory for any workplace to do their own risk assessment and decide what they want to do with it. In Sudan, South Sudan, or in Rwanda, there aren't any such laws. You will have to think about how you actually work with that country to develop the laws, and actually what are the actual laws themselves. Because they say, right, well, we're happy to do that. So you got to have the knowledge of doing that. So the leadership is important. Working with the team, occupational health is the truly multidisciplinary specialty. In one clinic, you will have the physician, you will have the nurse, you will have the technician who will do the audiometry and the spirometry, you will have the physiotherapist, you'll have lots of support the specialties there. Can I have the next slide, please, Sadir? And the safety is important. And if you think about it, that example about, epilepsy, for example, really is very, very important. If you think about it, someone with epilepsy, you advise they are fit to return to work, they go and have a forklift truck or whatever, and they kill themselves or kill someone else, you would probably be held responsible for that. Hadir, can I have number 8, please? Thank you. Quality improvement, I think the cohort who are here, who went through the course from last time, there was a whole talk about quality. And I think this is particularly important for us in the low and middle income countries. We do not want to actually have lip service. We really have to have real quality to the work we actually do. It is just the time. I really don't want to go into lots of details, but this is very, very important. And you will have to, and I say this is for practice, and at the same time, you will be specifically asked about it. Hadir? Thanks. Safeguarding, I think probably this is a word which we do not use in these parts of the world. People who who are vulnerable because of mental health problems, because of whatever happening at work. You got to identify this. This is very, 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 very important. You got to identify this and make sure that you know exactly if someone comes into your clinic in a really bad situation and they want to kill themselves, what do you actually do? And I think this is, when I say this can be an exam scenario. It really can be an exam scenario. Okay, Hadir, can you please move on? Education and training, and again, every occupational physician, I think I have started. Well, the training is not just for doctors and, part of what we do as occupational physicians, you train managers on how to manage things at work. Some of my colleagues last week, we were talking about, if you're returning someone with epilepsy back to work, you really need to have, train some people in there, people who do the first aid. What do they do if someone will have a fit at work? If the fit, continues more than 5 minutes, what are the implications? So again, you got to put a lot of that. And again, this is something that you will be specifically asked about. And the last one is research, Hadir. Thank you. This is the last one. Part of, in the UK, they will ask you to submit a research project. If you've done an MSc degree and you've got your thesis, they will accept it as your research project. In the Irish faculty, as Mu'tasim will come and speak, it is not, you're not asked to actually do a specific research on something. It is actually much more difficult because the portfolio will have cases, will have projects, including workplace visits, audits, policies, all sorts of things. It's not you just write about them. You actually go and research about, the best practice to that pins what you have stated in your portfolio. And I think I'll stop here. And I hope this has been helpful. Mu'tasim can comment on this, and he can go ahead with the rest of the actual exam requirements. I'm really sorry. You said we got 1 hour. I think I took the first hour. Most of it was with technical difficulties. but Mu'tasim is there. I hope he wouldn't have difficulties like I did.
Dr. Mu'tasim, can you unmute yourself?
Yes, because I was waiting for the host to accept me. Hello,
Right.
everyone. Assalamu alaikum. Wherever you are.
Sorry, Mu'tasim, can I interrupt?
Yes.
You've been introduced earlier. Okay.
Oh, okay, very good.
But let me introduce Mu'tasim is a good friend and a good colleague, and we've been working together for the last more than 1 or 2 years together in building capacity for occupational health. He is a consultant occupational physician. He is based in Cork in the Republic of Ireland. He is an examiner. He's been a board member of the faculty of occupational medicine in Ireland, I think, from his training days, and he is now an examiner in for the MFOM and LFOM exams with the faculty. Thank you. Sorry, Mu'tasim.
Thank you, Dr. Omar. Thank you, and hello, everyone. I would like to welcome every one of you. Some of the names look familiar to me, and some of them are new. So I believe for those who are joined for the first time, they are making the right decision by pursuing a career in occupational medicine. Okay, so now, if you really made your mind and you need to go and be an occupational physician, it might be worth it to tell you a bit of a story from myself. I have been working as an occupational physician for 17 years now, but I couldn't say I am occupational physician until I had a degree in occupational medicine. I think most of you are doing some type of occupational medicine, but occupational medicine is a distinct specialty now. I think there is some overlap between public health, community medicine, whatever you're doing. And sometimes some GPs also are doing occupational medicine. So whatever you're doing now, if you want to claim or to say you are an occupational physician, you need to have a type of a degree in occupational medicine. Does that make sense? Okay. So having said that, that means you need to think about the LFOM or the MFOM. There are some degrees you can get, like the diploma of occupational medicine. It is good. They will prepare you for further degrees. But always the Royal College certificates are internationally recognized. And certificates are not recognized by medical councils. If you have a diploma certificate, it's good you had it, but that might not make a huge difference in your career and in terms of promotion and career progress. However, if you have a membership from the Faculty of Occupational Medicine, that might make a huge difference. So you just keep that in your mind. Certificates are not classified in medical councils. To my knowledge, so the Saudi Council, for example, doesn't classify certificates. If you take a diploma, you will get a certificate, the diploma certificate. That might not make a big difference. Although you will have a good knowledge, but it might not make a huge difference in your career. So I believe the reason we are here today is to find a pathway to be an occupational physician. Dr. Omar is one of the leaders in this specialty, and he has trained generations. He has been really advocating for occupational medicine, and he has really put a lot of time training a lot of people from many, many countries, not only in our area, even doctors from other parts of the globe. So let's start with the licensure of the Faculty of Occupational Medicine, or what we call it LFOM. and the second degree is MFOM. What is the difference between the LFOM and the MFOM? Any difference between them? Anyone can just name a difference between them. Not the M and the L, okay? I'm not asking about these many questions. Practically, what is the difference between the LFOM and MFOM? Who will volunteer? Okay, I will make it simple. If you have the LFOM, that's a proof that you will apply the basic knowledge of occupational medicine in the workplace. Just draw a line under basic. While if you have the MFOM, that means you are capable to apply the advanced knowledge of occupational medicine in the workplace. That's the difference. The LFOM is the basic knowledge, but you're still occupational physician. However, the MFOM is the advanced knowledge. So that makes sense. You start with the basic and then you go to the advanced. Okay, so if you decide to go for the LFOM, what do you need to do? May I share my screen now, if I can, Hadir? Okay. The LFOM. Okay. Before I share my screen, I might let me go here. Before I share my screen, you need to be a medical doctor. So this is not like a social science degree, not like a master of public health. Anyone can do it. No. You must be a medical doctor. And you must be registered in a territory or in a jurisdiction. So you must be licensed to practice medicine somewhere. It's not enough to be a medical doctor. If you are a medical doctor and if you are not licensed to practice in a country, you're not qualified to sit for the exam. Let me make it very clear. You need to be a medical doctor. You need to be at least have what they call it basic specialty training. The basic specialty training is like having 2 years or 3 years after graduation. So also it's not going to be practical for you to graduate this year and immediately sit for the LFOM. So you need to have some time of experience. You finish your housemanship or what we call it internship in many places, and you need to have like basic specialty training. This is what we call it, basic specialty training. Basic specialty training mean working in your capacity as a medical officer or as a GP, or sometimes having a degree like a master in public health or might be satisfactory. The final decision to accept you to sit for the exam is to the faculty. The faculty, you need to apply with your CV and you need to testify your certificate. Those who have done it, they are familiar with this. You have to testify your certificate by a notary public or by a commissioner of oath. There is certain requirement available in the faculty website. I highly recommend you to visit rcpi.ie, rcpi.ie, which stands for Royal College of Physicians of Ireland. When you go to the RCBI website, and then the Faculty of Occupational Medicine, licentiate of the Faculty of Medicine, then they will tell you everything you need. So the basic requirement, medical degree, being registered in a country to practice medicine, and at least you have basic specialty training or basic training for 2 years after graduation. Okay, and then the exam is open once a year. at least now until 2025. This might change in 2026, but at least now the exam is always in January. Okay, so if you are targeting to sit for the 2020 okay, this is Dr. Khalid. I think he want to interact, but I think they are allowed. You can raise your hand, Khalid, and then the Hadir will give you the chance to speak. I would like anyone to interact, because those who have gone through the procedure just now will add very valuable contribution, like Dr. Khalid. But if you want to say anything, Dr. Khalid, please feel free. Can you unmute him, please, Hadir? Khalid Saeed. تفضل Dr. Khalid. Okay. Let me continue. Hadir will give you a chance, Khalid, no problem. Okay, so we're talking about eligibility for the exam, okay? So, and after eligibility, the second question is, when can you sit for the exam? As I said, the exam is open once a year, usually in January. And if you are planning to sit for the exam, you have to be prepared from now. The fees of the exam are reasonable compared to all Royal College examinations. There is no huge difference between them. MRCPI, MRCP, those doing OBS and gynae. Most of the exam, I think around 1,300 euro for the written exam. 1,300 euro. The exam fees are not a big deal. You can look at them before the exam, when the exam is open. It is very important to notice that the exam has a certain days to apply. Okay. Now you can unmute yourself. Yeah, now you can unmute yourself. Khalid, now you can unmute yourself. Good news. You have some freedom. Now you can say something. The exam will open in a certain date. It's not up to you to say, I want to sit for the exam now. No, you have to wait until the exam applications are open, if you will. Those who have done it, they are familiar with this. You will be waiting for the exam to be open when they accept applications. They call it accepting applications. So when they start to accept application, it's a certain time frame, most likely like 3 or 4 weeks. Then you apply for it, and then they will assess your application based on the criteria mentioned, and they will send you confirmation that you have been allocated the place in the next examination. So the faculty will confirm to you that you have been allocated a place. Okay, then you apply, you have been allocated a place. From where you're gonna take the first exam? You're gonna take it from home, believe it or not. We call it the written exam, which is the MCQs. We're gonna take it from home. You take it from home through what we call it remote invigilation. Remote invigilation is simply sitting in front of your laptop or your PC. There is certain requirement. It's very friendly. They will send you email with the practice to test your device. You need high-speed internet. You need a laptop with a camera, and you need a very quiet place. You need internet without interruption. Then they will verify your ID and then your surroundings, and then you will start the exam. I think most of the Royal College exams now, the MCQs are taken remotely. So you're going to take the exam from your home, where you are, in the Middle East, where in Africa, or in Europe, or in Australia, wherever you are, you're going to take the first exam from where you are. For the MFOM, you're not gonna travel. You're not gonna spend any money in tickets or airlines or hotels or taking time off, holidays. No, everything you will do it from home. And this is really very good. This is one of the benefits of COVID. The world has changed after COVID. So you're going to avail all these remote services. You're going to take the exam from home, the first exam. You're going to submit the second exam also remotely, and you're going to take the third exam. We're going to talk about the details. Now we're talking about the criteria to enter the exam and where to take the exam and how you can take the exam. So you know now if you're eligible to take the exam, you know you're going to take it from home. You know you're going to pay for it by, what do you call it? Let me take this phone call. 1 second. Hello? Sorry, we have the African Day today. We have been very busy with a lot of issues here in the local community. Okay, so as I said, the remote invigilation is very friendly way to take the exam. It's computerized. You're not going to miss any questions. It's very easy. And then also the portfolio, you're going to submit it from your home. 1 second. Khalid, if you have anything you want to mention, can you please mention it? I have to send a message right now. For that, I have to give a talk in the city center. There is a festival about the African Day in the presence of the Lord Mayor of Cork and the Dean of the African Ambassadors in Ireland, His Excellency, the Ambassador of Morocco. However, I had to join this webinar. So I have written the speech and I sent it to someone. So now we're talking about the exam and how you can take it and the eligibility criteria. Now, I think it's worth it to speak in some details about the exam components. Now I will share my screen. Okay, I will share my screen now. Can you see my screen now? Do you see my screen now?
Yes, Mu'tasim.
Okay. So now let's start with the LFOM. The LFOM has 3 components: the written exam, the portfolio, and the viva. Sorry, there's a typo error here. Viva. Okay. The written exam is the MCQs. They call it written exam. And you have to go to do this first. Okay, that's how it works. You have to do the MCQs first. And if you pass it, then they allow you to go to the portfolio. And when you pass the portfolio, then you do the viva. The portfolio and the Viva are connected. They are all, it's 2 exams from 1 material. Okay, so the written exam is 100 question MCQs, single best answer. Single best answer. Single best answer means there must be more than 1 correct answer, but they are looking for the best answer. Okay, there is a curriculum. There is a curriculum which will be covered during the course. The course covers all the curriculum of what you will be asked in the exam. So the 100 questions, they are all MCQs, single best answer, and you have 3 hours to answer the 100 questions. So you have 180 minutes for 100 questions. That means you have 1.8 minutes for a question. The time is okay. Nobody was complaining from the time. If you have good time management and you practice really well, I think, and you take it from home, I think that is something feasible you can do. It's not easy, but if you work hard on it, I think you can pass it. Okay, the successful rate in our previous course was really very high. Very good number of those who went for the course passed the exam from the first time. People here with us, I can recognize many names who passed the exam from the first time. So that is what is the written exam. The written exam is MCQs, 100 questions, single best answer from the curriculum, and you have 3 hours to do it, and you do it from home. The pass rate is not known until they will tell you when they send you the result. But expect the pass rate to be around between 63 to 67. It's not 50%. It's not a 50% pass rate. It is up to the faculty and the examination committee to decide the pass rate of this exam. Okay, let me make it very clear. The pass rate is not 50%. Although 50% in any exam, in fairness, is a pass mark. But in this exam, the pass mark, you might get 60, but you might not pass the exam. Pass mark. What was the pass mark for the last exam? Anyone remember? For the licentiate. Those who pass the exam. Anyone remembers the pass mark? Okay.
I think it was 67, if I remember well.
Okay, I think above 60, always above 60. Okay, so keep that in your mind, okay? Keep that in your mind. The pass mark is between 63 to 67. The more candidates do, they will increase the pass mark. Okay, so keep that in your mind. Okay, and the faculty is actively seeking introducing new questions because they have the feeling that some exam questions are being circulated or written by the examinees and being circulated among them. So they're always keen to introduce new questions. So if you pass the exam, the first one, which is the portfolio, the written exam, then you will be allowed to sit for the portfolio. And you have to consider something very important in your mind. There is no huge gap in time between the result of the written exam and the date you have to submit your portfolio cases. By portfolio, simply, it means writing a case that you managed, an occupational medicine case that you managed. How you write it, there is a template that will explain to you how to write it. Okay, you need to write it in a certain format. It's not like you're writing a clinical case to present it in a grand round. you write it from occupational perspective. Okay, briefly, you write about the referral and the presenting complaint and the occupational aspect of it, and why the employee was referred. Maybe Dr. Omar told you a lot of this in the specialty in general. And then you look at the occupational presentation, you do your examination. It's a consultation like any consultation, but from occupational perspective. And then you do, if there is differential, you do it. And then the most important thing is the fitness for work. How will you manage it from in terms of fitness for work? Is this employee fit for work or unfit or temporarily unfit? And how you will communicate that to the employer? And is there a follow-up plan? And then after you do that, you make it as a research. You do what they call it the literature review. For example, if you're talking about lower back pain, after you discuss the case and how the employee was referred to you and everything, then you will write a research, small research about the complaint or the case you managed. If it was lower back pain, if it was depression or whatever, you write about the case in terms of it is incidence or prevalence in the literature, and how, from occupational point of view, how does that impact the workforce, absenteeism, how does it cost the economy, and if there is any approach to it. Okay, and then you write your references. You write your references also. You cite them in a certain way, and you are allowed 1,500 words. The number of words are numbered. This is without the references. So you write your portfolio. We'll train you, we'll show you how to write portfolio. How to write a good portfolio is one of the components of the course. So we'll walk you through the journey. We'll walk you through the story. We will guide you how to write portfolio. Okay, and I advise anyone who is coming through any interesting cases to keep them as portfolio cases. If you have an interesting case, keep it in your desktop, and it could be a potential portfolio case. Okay, and in portfolio, you need to write 5 portfolio. 3 of them are clinical cases. And by clinical case, we mean clinical case you manage as a GP, in your capacity as a GP, or capacity as a GP with a special interest in occupational medicine, or even as an occupational medicine or public health physician or whatever. And then you need to write 1 case about worksite visit, worksite visit assessment. So you visit worksite and you assess the hazards in that worksite, and you write a report about your visit. We will also train you about how to write a worksite visit. Then the 5th one will be an injury. So it's a clinical case, but it has to be an injury. So you need to write 4 clinical cases. 1 should be an injury. Okay, and the 5th is a worksite visit. Is that clear? Any questions here? So 5 cases for the portfolio, 4 clinical cases. 1 of them is an injury case, but they will not accept cases from healthcare setting. Don't write an injury about hospital, or sorry, they will not accept worksite visit in a hospital. Don't write your worksite visit in a healthcare setting. They will not accept it, because any doctor is working in a healthcare setting. So that is not a privilege. It's not, you're not bringing something new. It needs to be any worksite visit, industrial, where other employees are working other than hospitals. So that is what is the portfolio is. The portfolio is a research document. As Dr. Omar said, in UK, for the MFOM, you write a research. You have to write a dissertation. But here, the MFOM of Ireland, there is no dissertation because you will be writing 15 cases in a research way. You'll be familiar with how to write a research. Okay? So again, in summary, portfolio, you have to pass the MCQs. Then there is no gap. Time is very short. You really, a lot of our candidates struggled. Maybe some of them listening to me now, they struggled in submitting the portfolio because of the time. Portfolio is an open exam, but it's not easy. You have to put quality time on it. Okay? 3 clinical cases. 1 clinical case must be injury, and the 5th one is worksite visit, should not be hospital setting. And then you have to wait for the result of the portfolio. And when you pass, hopefully you pass, hopefully, then they will invite you for a viva. Viva means defensing your work. They just want to make sure this is your work. Okay, they will do it remotely also. 2 examiners will examine you. They will select 2 cases from your work. They will let you know that they will ask you about case of depression, for example, you wrote, or carpal tunnel syndrome, or whatever it was. And the other case maybe could be like the worksite visit. And then they will ask you, expect any question. Not only question about the case, they might ask you about the knowledge around the case. For example, if you wrote question, write a case about mental health, okay, they might ask you all the questions, how this came to your desk, and how did you manage it, and under what capacity, and why did you declare him fit, and why you didn't declare him fit, and why you call him for follow-up, and how did you assess your mental health? Then they might ask you some theoretical question. Give us some of the tools you can use in the workplace to assess mental health. Okay. Might not be directly written, but they want to know. You can't say you manage the case of depression without knowing how you can assess a mental health. You have a tool of mental health, right? Then whatever scenario happens to you, you say, oh, I did well in the viva, and then I failed, la, la, la. You can ask for clarification, but it's all about your knowledge about what you have written. When you write a portfolio, you need to know your case very well. And when you write a literature review, you need to really write a good literature review, and you have to put a quality time. You need to put a quality time in your portfolio. Before, when I did the exam, portfolio was first, so we had time, and then we went for the MCQs. Now they changed it. And then when you do the viva, and if you pass the viva, then they will send you an email that you passed all the components of the LFOM, and you will be called for the ceremony to be awarded the degree. You have to differentiate between passing the exam and being awarded the degree. These are 2 separate issues. You pass the exam, that's okay, but you don't have the degree. Now I know some of you passed all the exams, but they don't have the degree yet. Right, Samira? Is she still here with us? Okay. So passing the exam does not mean automatically you are awarded the degree. There is no obstacles. You will be awarded the degree, but you have to wait until November. Unfortunately, the faculty has 1 ceremony per year, okay? Always the 2nd week in November. You will be invited. to attend the ceremony in the Royal College, which I encourage everyone to attend. They will facilitate your visa. That's the only time you need a visa now. You will not need any visa to come to Ireland, only to attend the ceremony, to get your certificate from the president of the Royal College.
We will come, inshallah.
Okay. I highly encourage you, Samira, to come. This is your hard work is paid off now. You need to come and celebrate your success and wear the gown here in the Royal College and know this place and have some connections and feel it really, feel your success, how it really give you a boost in the future. So that in summary, it's a brief journey through the requirement of the exam and the components of the exam. And I am happy to answer any questions. Are we talking about LFM only, right? Are we talking about MFOM or LFM?
You can talk about the MFOM as well, Muhtasim, but just in a brief thing. Okay, briefly. The same components apply. The written exam, 100 questions. The portfolio will be 10. Instead of 5, it will be 10. It's going to be different. Okay, it's going to be 5 clinical cases. Put them aside. 5 clinical cases, okay? The other 5 will be 2 workplace assessments. 2 workplace assessments and 3 projects. And project means anything you have done in the workplace. Policy, you have done audit, anything you have done in the workplace to improve the practice of occupational medicine. If you wrote a policy about vaccination, if you have done anything, policy to increase, for example, absenteeism rate, whatever, any project, there is some guidance. You will be provided with the guidance. So the written, you will submit 10. There is no change in the portfolio. However, the portfolio questions will be more difficult. Have to be frankly with you. This MFOM, those who have sat for the MFOM, you know that. Those who have sat for they know that, okay? So the 100 questions will be more difficult. Portfolio, the requirement expected to be higher and the number of words less. Have to be focused, okay? 10, 5 clinical cases. The other 5, 2 workplace assessment, same concept, and 3 projects. And then you will do the Viva again. You will do the Viva again for the portfolio cases. The only thing new here is the OSPI. The OSPI, you will need to do 8 clinical stations, and you need to pass 6 out of 8. 6 out of 8. The clinical stations could be manned or unmanned. Could be taking a history, could be examining a patient, could be interpretation of a result of audiometry or spirometry. We call this unmanned. There is no interaction, only paper on the table, and you will see a question, audiometry, interpret the result of this. Then you will interpret it. And we will also guide you. If you're sitting for the MFOM course, we had a course. This was exactly similar in terms of the setting and in terms, we had even OSPI stations. We had Viva, we had everything. Portfolio, we have explained all this in the course. So the OSPI 8 station had to pass 6 out of 10, 6 out of 8. The report writing. The report writing is what Dr. Omar is mentioned. We're doing it now with those who are sitting for it in very soon, I think, in June, second week of June or first week. It's a report. You write it to either to employer or to a specialist or to a GP. They will give you a scenario and you need to write a report. Clinical stations, you have 10 minutes for each station and you have a break, 2 minutes between each station. Report writing, you have
I think, half an hour, Khalid? Half an hour? It's not that much. Half an hour. Critical appraisal, I think you will have 2 hours. So the time will be explained, but these are the components. So in summary, you will go for 3 exams for the LFOM, and the same 3 exam, the written portfolio viva, plus 3 other exams. So for full membership, you will pass 9 exams. I haven't seen any membership, you need to pass 9 exams, only the membership of the Faculty of Occupational Medicine. But don't be scared, okay? These are all visible and they are all repetition. If you know what matters from the LFOM, the MFOM, there is nothing new for you. Only this, the stations and the report writing, which you will always be familiar from preparing for the LFOM. So that is the MFOM and the LFOM and their components. Any questions?
Thank you very much, Mu'tasim. Thank you very, very much. That really is very helpful. One very important thing I would like to add to Mu'tasim before we open the floor for questions. Really, from what Mu'tasim has said, our experience from the last courses, I think the important thing is this exam, each part of it is actually a practical exam. And it actually examines those 11 bits I have put on those slides. In every single one of them, it is examined. So, and this exam is actually unlike the MRCP or the MRCS or MRCGP. The MFOM exam in particular is an exit exam. It's not an entry exam. So as Mu'tasim has said, when you've been awarded the degree of an MFOM, that means you are a specialist in your specialty, that you have achieved, this holistic level of knowledge. So that is why I think it's important to understand you are being examined in things that, and I said this to the colleagues, and I put it there. This is something that, again, is one of the barriers. When we spoke about report writing, every occupational physician in Ireland, where the exam takes place, would write 8 reports every day, at least 8 reports every day. When Mu'tasim was with us last time, he said that day he wrote 10 reports. So this is what people do every day. Unfortunately, even in places in our regions where there are occupational health services, no one writes occupational health reports. But we got to practice doing this, and this is going to be a really important element of the course. Not just at the report writing and the template for it and whatever. Anyone can do that. It is just actually getting yourself in writing reports, because this is the product of the occupational physician. The occupational physician does not give an injection or write a prescription. You write a report, and you got to be really good at that. Thank you very, very much, Mu'tasim. So we'll open the floor for questions. Hadir?
Yes, doctor. Everyone is able to unmute him or herself. So you just raise your hand, Dr. Omar. You take charge of this. Thank you.
Okay. Yeah, thank you very much. So please, anyone who wants to put their hands up and speak. I hope we haven't frightened you, scared you off.
يعطيكم العافية. جميعا. والله
Thank you so much.
وحشونا كلكم يعني we miss you all. We miss our days. I don't think you frightened us before, and I hope that you did not frighten anyone. I'm giving them that. صراحة we were in a good hands, Dr. Omar, Dr. Mu'tasim, and all the team, Dr. Muhammad also, I remember him. So everybody is gonna be in a good hand. I'm talking from a previous experience with you. Inshallah, we will go ahead for the next level, and inshallah, we will do the best with you. Thank you.
Thank you very much. Thank you very much, Samira. Samira did the LFOM course or the joint course last time, and she did very well. She passed her LFOM all exams and waiting to go for the ceremony as Mu'tasim has just said.
When it
And
will
we are all looking for the fairest Qatari member of the Irish College of Physicians. I think this would be, this would be the real achievement for Kuwait, to be honest with you.
Inshallah. Doctor, I'm sorry, when it will be the ceremony for the end?
November usually.
Oh my God, it will be very cold.
It will be cold, but
I hate cold weather.
Rarely below zero in Ireland, rarely.
Hadir is our colleagues from South Sudan here. I can't see the names.
By the way, today was an African parade with flags. I was fortunate to carry the flag of Sudan and South Sudan.
Excellent. One in each hand.
I felt
Oh
it's
my God.
part of one country.
I see Ange and Hornet are both here. Welcome, Ange and Hornet. These are our colleagues from Kigali in Rwanda. They've been a great help to us in Rwanda.
Yeah,
Thank you.
Thank you very much. Right, I think no one seems to have got a question. Okay. Do you think I will know? Yeah, we've got lots of we've got a colleague from Tanzania. I think Hadir, did we have someone registered from Tanzania this time?
Yeah, we have from Tanzania, but some of the participants did not use their names getting into
All right, okay. No, that's absolutely fine. Yes, Harniet, yeah, please go ahead. Harniet, please unmute yourself and talk. Hadir Hornet is not able to mute. Can you please unmute her?
Good evening. Thank you so much for your presentation, Dr. Mutassim and Dr. Omer. Yeah, it was really a great pleasure from hearing people like you. And I actually have two questions. The first question, I guess, from Dr. Omer's presentation, there is where he mentioned that there is a difference between the occupational health and the occupational medicine. Okay, so before attending this, in my mind, I thought it was one thing, and I tried to Google the difference. But I just wanted to ask if maybe you could just briefly tell us like the main difference between the occupational health and the occupational medicine, and also about the training. I heard there is a residency program and maybe another training of 2 years, of which I really did not get all the difference. If you could tell us the difference between the occupational medicine and the occupational health and about their training. That's my first question. And the next question is about the licensure exams. Like you talked about the LFOM and the MFOM. So my question was, can someone write or sit for the MFOM without writing the LFOM, or it's more like the LFOM is the first step to writing the MFOM? Thank you so much.
Thank you very much, Hornet. Hornet is, as I said, is a colleague from Rwanda, and Hornet and Ange were a great help to us and to the center there. And I think when we went into Rwanda initially, there were about 10 or 11 doctors who are interested in occupational medicine. I'll very briefly go the first part and leave Mu'tasim to explain, the exam, what can you take and what you cannot. Occupational medicine is a clinical specialty for doctors and nurses. So you cannot be a safety specialist or a public health officer, as they call them, from any specialty away from the medical field, and do a degree in occupational medicine, or a physiotherapist, for example. To do a degree in occupational medicine, you've got to be a doctor or a nurse. Occupational medicine from the Irish faculty, for example, or the UK faculty, this is for doctors only. This is not for nurses even. You cannot be a nurse and do the LFOM or the MFOM. Okay, the difference between, occupational medicine is the actual clinical specialty. If you think of occupational health as the big church that, involves, that will have everything inside it, it will have the doctors, it will have the nurses, it will have the physiotherapists, it will have the psychologists, the safety officers. All of these are, part of this big occupational health in general thing. The occupational medicine is actually the medical thing that is connected with the doctors specifically. Okay, so you take it from that end. Mu'tasim will answer, whether you can do the whole exam, just go for the membership, and skip the L. I think that would, yeah.
You can do that,
yeah.
But it's not recommended. Simply, I'll tell you my experience, and even the director of the training here in Ireland, I work with her, we work together. She doesn't allow anyone of the who are in the training to sit directly for the MFM, because you're risking your work. You have to submit. You have to do the 200 questions together. You will do this today and you do this one tomorrow, for example. And then you have to submit 15 portfolio together. And for example, if you sit for the 2 MCQs and you pass the first paper, okay, and you submitted the 15 portfolio because you didn't pass the second paper, so you failed the MFOM written. While you could have get the degree if you applied only for LFOM, you applied for 100 questions and you submitted the 5 portfolio requirement, at least you will end with the L degree. While you will submit, you will go through 200 questions, you didn't pass the second one, you will not get the LFM because you didn't apply for it. So you can, in simple answer, you can, but it's a risk. It's a risk. I don't encourage anyone to do it. I myself, I went through this route. LFM first, take a break, then do the MFM. That is what the SPRs or the residents do here. So, but you can do it. I know one did it. I think one of our candidates did it.
Yeah.
I don't know what happened to this candidate. What happened?
She passed the LFOM, not the MFOM.
But so she will not get a degree.
No, because I think she did not pass the MCQs, so she submitted only the 5 cases for the L.
Okay, so that's the benefit of this. Before you submit the portfolio altogether.
Exactly. So you know which one you've passed. So I think technically you can, as Mu'tasim has said. I think I have advised some of the colleagues from the past group who did not pass that because they've done quite a lot of work, and I know from my personal experience they probably are MFOM material rather than LFOM material. I advise them to go for the 2.
Okay.
I hope I'm not sticking my neck out here, but yeah, I know this is. It is just like what that Russian poet said. This is something that the one who killed himself said. This is something that I do, but I do not recommend it for others. Yes, it is something. I mean, those of you who've gone through the LFOM exam, they know how tough the exam is. So to go for 2, it is not an easy decision. So this will be an individual thing, and I think we probably still, even the people I counseled and said that we probably need to have another discussion around this, with myself and Mu'tasim at least, and we have a discussion, one-to-one discussion, so it is not just my own personal views, if you see what I mean. And I was just told that we've got a colleague from South Sudan here, actually, and in the group, which is absolutely great news. Absolutely great news.
Dr. Hufni wrote a question, and I'll try to read it. What are the career benefits and opportunities after passing the LFM and MFM?
Can I answer that?
Yep, please do.
Okay. How long I have? Few minutes? Can I share my screen again? Okay. Can I share my screen again?
Yes, you can, Doctor.
Okay. So I didn't want to go through that because I want to stick to the schedule, but I can show you this is the next slide. Where do occupational and environmental medicine physician work? You can work in hospitals, in clinics. You'll be like occupational health physician in a hospital. Or you could be in academia. You can work in colleges and university as a professor of occupational medicine. Or you can do industrial occupational medicine in factories, sites. You can be like working with a oil and gas company or in a factory or whatever. Also, you could be some professional sport team. You could be the occupational physician of some sports team. Okay. Or you could be working for government agencies like a military or civil service. And the good news, you could be an independent practice. You have an independent practice. You're doing a clinic or occupational health center, doing some consultation services for those who need the services, like companies. A lot of companies, they don't have an in-house doctors, they outsource the service. They sign contracts with occupational health doctors who have their own clinics to provide the service. Or you can work in teams and resorts like Disney. They have occupational physicians, large corporations, okay? And you can sit with some colleagues, have and as I said, an independent practice, and you can also work for law and safety enforcement. So the good news about this specialty is they have a variety of areas you can work in. So there's many.
Thank you.
You can work.
Yeah, good.
Had a lot here.
Can I take this on, Muqtasim? Just this and Hornet. I see Hornet is written. I think about the length of training. The specialist training in Ireland and in the UK is 4 years, just like the rest of the other specialties. But you'll have to pray probably much more than you're praying now, Hornet, to get into a spot there. But as Muqtasim has put all of that, I'll just tell you about my own personal experience. I was an orthopedic surgeon for many years before getting into occupational medicine. I probably would have stayed doing hips and knees, and I would have certainly retired. I don't know whether that's good or bad, but as an orthopedic surgeon, yep, I was looking at knees and hips and doing hip replacement and knee replacements forever, for absolute ever. Right, occupational medicine has changed my life completely, absolutely, totally, completely. The last actual job I had was I was the Federal Minister of Health in Sudan. Some of you would probably know this, and I got this partly through politics, but 99% through occupational medicine. How? You would probably remember the COVID and what happened to the COVID, how many colleagues we lost in Sudan, and we started giving advice, to the people in Sudan about how to actually protect the healthcare workers about COVID and keep a safe and effective services running for the population. And that is how I got into this. So it got me from just a doctor doing some clinics I was in the UK, very busy, and it was an amazing job. That was absolutely the best job I had in my whole life. The chief medical officer for the biggest fire and rescue services in the UK for many years. So from that, I moved to be the Federal Minister of Health. From there, we established the Center for Occupational and Environmental Health, Africa. And through that, as Hadir and probably Angel Horniet would tell you, we've met in Africa. We met the director of health in the African Union. We're supposed to sign an MOU with the African Union. We met some of the highest offices in Rwanda. We went to the office of the president of Kenya. So this was all where occupational health can actually lead you. I am probably interested in the common good for a big part of me. I know some of my colleagues who are who said, right, okay, we've done that, as Muqtasim said, yeah, going to work independently as consultants. And I think I told some of maybe Hadir knows this. I sat with some colleagues not long ago talking about their experiences. One worked for a company called Lafarge, one worked for Shell, and one worked for a transport company. Two of them retired. They retired before the age of 50, and they were millionaires. And I'm not joking. They made so much money because you can earn so much money in occupational health. This is one part of it. We're talking quite general things. But if you think about it, for the colleague from South Sudan, there is not a single occupational physician in South Sudan. You can imagine if you are the first accredited South Sudanese occupational physician. Dr. Hadir would remember the colleague when we were at the Ministry of Health, because there was absolutely no occupational health services. We actually, one of the students who passed the MFOM and went and worked as an occupational physician in Canada, we actually got her to head the Directorate of Occupational Health at the Ministry of Health in Sudan to develop occupational health, not just for that, but for the Eastern Mediterranean region of the WHO. And I could tell you, I was the Federal Minister of Health. This girl was paid by the WHO, or was supposed to be paid by the WHO, and her salary was at least 10 times a year, maybe 20 times more than my salary. So, occupational health in our parts of the world will open doors and doors for you.
Hi, everyone. Thank you, Dr. Omar. Thank you, Dr. Muhtasim, for this presentation. I just have a question for Dr. Muhtasim.
Can you please identify yourself? Say your name, please.
My name is Hiba. I'm a medical doctor in Ireland now. So my question to Dr. Muhtasim is, I'm asking about the job opportunities for junior doctors in Ireland.
That's a good question.
Yeah, like
that's
just
a good question.
Who passed the L, for example, or the juniors who want to start the career there. The second one about the opportunities for the training in Ireland for Sudanese or for foreigners in general.
Okay,
Thank
the
you.
opportunity for training is very limited because the specialties they accept 2 or 3 every year only, maximum. And they have to be Irish or EU citizens. Okay, so same like any specialty training, the other specialties, they might have more chances because they accept more. But in occupational medicine, they accept only 2 or 3. Okay, to answer your question about job opportunities, if you have no degree at all in occupational medicine, you just want to pursue occupational medicine through work, the chances are very limited because they want you to come and do the work. So they expect you at least you have licensure. You can still have a chance to work. I'm talking about Ireland. Don't forget that the market in Ireland is very small compared to UK. See how many hospitals are in UK? A lot. UK has a lot of hospitals, factories, whatever. The need for occupational medicine in Ireland only in corporates. You cannot work in a hospital without being in the specialist register. The hospital, like for example, Cork University Hospital, which is the biggest hospital in Ireland, they have only 1 occupational medicine physician. So if they hire this until he retires, there will no opportunity. But in the private sector, if you have a degree like LFOM, there is a chance. The chances are available. There is a chance for a job. Okay, it depends on the practice. They need a junior, and the chances of a junior might be more likely than the specialist. Okay, but if you have the full membership, your chances are very high. You're highly likely to get a job in Ireland. Okay, hopefully that answered your question. The training, very unlikely because they need EU and Irish. If you are EU and Irish, and you are in the special, if you have done some type of basic specialty training, then you can apply, you meet the criteria. Then the competition will be very high because from 15 or 20 applicants, you will go through several interviews. At the end, they will choose 2 or 3 maximum. So still you have the chance, but it's going to be very high competition. Without degrees, the chance is very unlikely unless practice is desperately need a physician, and they will hire you so you can do some type of job for them, and then they will be very patient until you learn and train occupational medicine. If you have LFM, the chances are good. If you have MFOM, the chances are bigger. Hopefully that is answering your question.
Thank you, Dr. Mu'tasim. We passed our time, but I just request a couple of minutes more to answer Dr. Farah's question. I'm really sorry, guys. We passed the time, but I think we still have many more questions to go. But we can share the contact details later, and then you can have all the questions that you have answered. So Dr. Faraz is saying, I'm currently pursuing, what is that?
Diploma Occupational Medicine.
Okay, this is the Diploma of Occupational Medicine in UK. Should I go for LFOM as well, or MFOM after that? Can I register with Ireland faculty after doing a diploma?
You want me to answer that, Dr. Omar?
You can, yeah.
You don't register with the faculty, you register with the medical council. The faculty doesn't register anyone. The faculty is not a licensing body. You have to register through the Irish Medical Council. The Irish Medical Council is completely different than the faculty or the Royal College. It has nothing to do with, it's a separate entity. The diploma, I think, is widely respected in UK. Okay, I think Dr. Omar might give you more input in this. In Ireland, they prefer the licentiate. Okay.
Yeah, you're right, Mu'tasim. Yeah, you're right. Yeah, carry on. Sorry.
Yeah, I think that's it, probably. You can add.
No, well, thank you. You know, the diploma is excellent. The diploma is excellent. There is another diploma in Ireland through the Royal College of Physicians, the IHED one. It is also a very good degree. Both of them will actually give you good grounding, good knowledge, you know, to actually proceed to the LFOM. You still need to do the LFOM. It is not the faculty, you know, does not recognize this as a as a condition for you to do the LFOM, and it does not give you an advantage over someone who has not done the degree, unless apart from the knowledge, if you see what I mean.
All right.
Because I can see some of the chaps from the IHED group here as well, which is a course that is really would give people good grounding in occupational medicine, you know, towards the L and M exam. I just wanted to add a bit to what Mu'tasim said about the accredited training in Ireland. This is again some of the experience. I know some of our doctors who did their membership here in the Middle East. They got jobs as occupational physician in Ireland, and once you get in there, it is just like the UK. You go through what is called the Caesar route, which is I don't know whether they got the same name for it, but it is a certificate of equivalent training in occupational medicine. So you actually get into, submit a portfolio to the faculty to get on the specialist register eventually, if you see what I mean. And I know at least one of the doctors has managed to do this.
Yes, you're right.
Good. Thank you, doctors. It's been very interesting as usual. And we will send the recording and all the materials discussed in this webinar through emails. Make sure that you leave your email if you did not come through the registration link. Thank you very much, and please continue to follow QUIHA website for any updated materials, and we'll be in touch. Thank you, and enjoy the rest of your weekend for the people that still have tomorrow. Okay, bye. Thank you.
Thank you very much. Thank you, Hadi. Thank you very much, Mu'tasim.
Bye, everyone.
Thank you. Thank you very much. Bye-bye.